Jeremy Hunt, thanks for being with us. I hope you heard what was said there by the Royal College of Physicians. Even 8 billion would be not enough to get what you're talking about put in place in a comprehensive fashion.
Well, first of all, I completely agree with Professor Dacre that this is an incredibly important step in improving the safety offered by the NHS. We inherited some terrible tragedies at Midstaffs and Morecambe Bay and a number of other places, and we have resolved to make the NHS the safest healthcare system in the world. We've got 8,000 more nurses on our hospital wards. We've got a new chief inspector who's going around raising standards.
But 8 billion,
and this is
Jeremy,
the next really big step. Yeah, no.
Where's it coming from?
Yes, so let me explain how that works. So NHS England have been working at this for some time. They're very enthusiastic, as I think we all are, to do this. And they say that if we don't reform the way we operate the NHS because of the pressures of an ageing population, the gap will actually be 30 billion by 2020. And they said that we need to find efficiency savings, and they sketch various scenarios, and they don't say the 8 billion saving, but what they did say to the government last autumn was that the first year of that plan, in other words, the next 12 months, they needed £2 billion, and we provided that £2 billion as a down payment. But after that, we've said we'll back what they need, and we're doing the work now to see that will obviously be negotiated as part of the spending settlement next year.
Okay, so £2 billion is being pledged. You'd go to 8 billion and beyond, as the Royal College of Physicians have just said is necessary, and you seem to accept those sorts of figures are realistic.
Well, NHS England themselves said 2 billion was what they needed for the first year. But what I would say is that when you have a growing economy, you can start to put more money into the NHS. And we put 2 billion in the autumn statement. There was another billion for the NHS for mental health in the budget. And there is a very clear choice, because 5 years ago when we came to power, the great challenge in the NHS weren't talking about whether we were going to be putting in extra money. The question was whether we were going to have to cut the budget. And in fact, the Conservatives were the only party that pledged not to cut it.
Well, hang on. You mentioned the last election. In the last election, page 47, your own party's manifesto, quote, "We will commission a 24/7 urgent care service in every area of England, including GP out-of-hours services." You failed on that. So why, going into this election, should anyone believe the Conservatives on this pledge?
We haven't failed on that, and I just want to finish the point on the economy, and I'll answer. We actually made very good progress over the last 5 years in this direction, and I think your package showed a number of hospitals like Salford, Chesterfield, Sheffield, who are doing this. We've also got a third of the population now on track to have 7-day GP appointments, evenings and weekends. So we are making good progress. The point about the money, though, is this. The choice at the election is between David Cameron and Ed Miliband. Ed Miliband and Ed Balls want to tear up the economic plan that's created 1,000 jobs a day. All those jobs are people paying taxes that are helping to fund the NHS.
Sure, but
we know when we look at other countries, it's very important. We know when we look at other countries, Italy, Ireland, Greece, Portugal, they didn't have a plan, they lost control of their finances, and they had to cut their health budget. So the biggest risk right now, if we want to put this extra money in, the biggest risk is to tear up the economic plan that is now allowing us for the first time to put real increases in funding into the NHS.
You have a mountain to climb in terms of the funding necessary, don't you?
Well, there is a need for extra money, no question about it. We've got 1 million more over 65s in the country than we had at the time of the last election. The pressures of that ageing population can only increase, and that's why it's so important to stay on track with our economic plan so that we can continue putting more money into the NHS.
Jeremy Hunt, thanks very much indeed for being with us.